to give his welcome message para po sa ating lahat ngayong hapon na ito is the PSI National Training Director and the project head of the National Sports Summit 2021. May I call on Sir Mark Edward Velasco.
Good afternoon. In behalf of the board and chairman of Philippine Sports Commission, I'd like to welcome you to this afternoon's eighth session for the Sports Summit. Today's program is very exciting as it is very applicable to our present situation. Once again, thank you so much on behalf of the board and the whole of PSC. Welcome to the National Sports Summit.
Thank you, Sir Mark. And to deliver his inspirational message on behalf of the PSC board, let us all welcome our commissioner, PSC Commissioner Ramon Fernandez.
Good afternoon again, everybody. On behalf of the Philippine Sports Commission, led by our chairman, William Boots Ramirez, and my three other commissioners, we'd like to welcome you again to this session of the the National Sports Summit. At the very onset of our term, the first thing that we did was to go all over the country and present to the LGUs, even the DepEd, of what we want to do with regards to sports, programming the sports at the grassroots level. That's why this event is also very important. In spite of the COVID, at least we are able to gather all of you from all over the country and talk about sports. We need your inputs. The PSC cannot do it alone. We need the inputs of all of you stakeholders in this project. So thank you very much for joining us in this summit. And we hope we can come up as one, an honest to goodness grassroots development programs for the Filipino athlete. Mabuhay ang atletang Filipino. Good day to all of you.
Thank you very much, PSC Commissioner Ramon Fernandez, for the inspirational message. Maraming salamat po, Com. And tama po ang sinabi ni Com. Lahat po ng mga inputs natin today, I will encourage you to participate and take part sa ating pong summit. Today's session po is one of the many lectures we will be having for the first phase of the National Sports Summit. As said earlier, sports conversations will be presided over by recognized figures from local to the international sports scene to deliver short lectures in the online conference format. Afterwards, an open forum will be facilitated to gather insights and views as a synthesis for every session. And to help us on that matter, kasama po ulit natin, returning as one of our moderators for Batch 2, you know her po as the president of the Philippine Society of Women Orthopedic Surgeons Incorporated for this year up to 2023. She's a past president of the Philippine Orthopedic Society of Sports Medicine from 2016 to 2018. She's a former secretary of the Philippine Society of Women Orthopedic Surgeons Incorporated. She's an active consultant at St. Luke's Medical Center and a visiting consultant sa ating pong St. Luke's, Quezon City. She's an active consultant as well of the Focus Athletics Common Center in Alabang. And currently, she is an active consultant of the Philippine Sports Commission sa ating pong MSTAS unit. Help me in welcoming again our moderator for this lecture, Dr. Janice Ann F. Espino de Vera. Good afternoon, ma'am. Hello po.
Good afternoon ulit sa'yo, Josh. And maraming salamat at inimbita niyo ako ulit na maging facilitator or moderator for this afternoon. No? So I know that everyone is excited to introduce our distinguished speaker for this afternoon. So he finished with a degree of Doctor of Medicine in the University of the East Ramon Magsaysay Memorial Medical Center. Then he did his postgraduate internship in the University of the Philippine General Hospital. He then pursued orthopedic surgery residency training in St. Luke's Medical Center Institute of Orthopedics and Sports Medicine, after which he did his clinical and research fellowship in sports medicine and arthroscopy in the University of Cincinnati, Cincinnati, Ohio. For those of you who do not know, that's where the home of the Cincinnati Bearcats basketball and football team and the home of the NFL team Cincinnati Bengals. He later on did another orthopedic fellowship training in the Eastern Indiana Orthopedics and Sports Medicine in Richmond, Indiana. He is currently an active consultant and assistant professor of the Department of Surgery in UERM Hospital and UERMMC College of Medicine, and a visiting consultant at the Department of Orthopedic Surgery, Philippine National Police General Hospital, and Department of Orthopedic Surgery in the Medical City and the Department of Surgery in Medical Center, Manila. He is the section head of the Shoulder and Elbow Surgery section of the Institute of Orthopedics and Sports Medicine in St. Luke's Medical Center, BGC, in Quezon City, and the section of Sports Medicine of the same institute in BGC. He is currently the director of the Institute of Orthopedics and Sports Medicine of St. Luke's Medical Center in Quezon City. He is also the medical director and medical unit head of the Philippine Sports Institute, Medical and Scientific Athlete Services of the Philippine Sports Commission. He has held a lot of positions in the field of sports, such as chairman of the Philippine Football Federation Sports Medicine Committee and a member of the FIFA and AFC International Football Medicine and Doping Panel and the AFC Elite Medical Panel. He is also a certified football medicine instructor of FIFA Football Medicine Program. He is a team doctor and surgeon of the Philippine men's and women's national football team. He is a FIBA 3-on-3 tournament medical officer and a consultant physician of the PSL Petron Blaze Spikers and the assistant team physician of the Ateneo Blue Eagles basketball team. Ladies and gentlemen, it's my pleasure to introduce you my chief resident when I was a first-year resident and my kuya in the orthopedic sports medicine field, Dr. Randolph M. Molo.
Good afternoon po everybody. Thank you for that kind introduction. Let me just take a few seconds here to set up my lecture. Magandang hapon po sa inyo lahat. I'd like to acknowledge, of course, Sir Mark Velasco, our National Training Director, for extending the invite to me to talk about our experiences in the past year with regards to taking care of sports and athletes in the COVID environment. No? So this afternoon will be about talking about our experiences. It's a very informal lecture. It's not too medical. And just to set the tone for this afternoon and kidding aside ng konti, I hope you don't mind talking, that I'll be talking in Tagalog, both in Tagalog and in English. And COVID itself enough is a stressful and maybe for some people serious issue, but we'd like to put it in a little bit more light manner today, but at the same time respecting all of those who are taking care of people who are afflicted with the condition. All right, so for the next hour, it's an overview of my lecture. We'd like to see how COVID changed us as a nation and as a society for the past year. If you notice, we tend to do things differently now. Marami pong binago ang COVID sa behavior natin, sa mga gagawin natin. Nowadays, when we start to think, we have to think first on what to do before we even act. Kasi lahat po ng mga dating kinasanayan natin, medyo binago po talaga ng COVID. No? Besides that, I'll be talking about the timeline as to how the virus affected us in the country, all the way from when we started with the lockdown and eventually how we worked our way towards returning people back to sports. And being at PSC and taking care of sports, we do understand the importance of physical well-being and mental resilience. That's why we want to make sure that all of this is done as safely as possible. Next, we will talk about how COVID-19 tends to affect the athlete. Maybe we'll share a few things for you on the sports medicine end of things for that. And finally, and medyo pinaka-trending na topic today, vaccination. So we'll also like to find out how vaccination will tend to affect an individual, maybe an athlete participating in sports. And consequently, lahat po tayo, how we can get more information about vaccination as a whole. So we'd like to cover that for the next 60 minutes. I think we have an hour for your questions, which I think is far more important than my lecture. But just to get things started, imagine December 2019, no? Yung po yung pinakahuli nating experience sa sports. We were just coming off hosting the SEA Games. And for a lot of us, we were coming off a natural high, emotional high with all of the participation and organization and the results that we got from that SEA Games. If you can imagine, you can go to stadiums, you can maybe cheer for your athlete. Ganyan po itsura ng sports noong December 2019. That's just like less than 2 years ago. Fast forward a little bit to 3 or 4 months later, in less than a year's time, nagbago po lahat. Obviously, tayo binago ang ating mga sitwasyon as to how we used to do things. And therefore, most of us, as we are adjusting to this kind of new situation, maraming adjustment period. But that being said, we have to accept and just make sure that everybody moves on safely para din masigurado po natin na yung kapakanan or health ng atleta natin ay hindi nakokompromiso. Take a look at this. This is what I call the COVID Wall of Fame. No? I'm sure marami dyan sikat, kilala po ninyo. You're looking at maybe Kevin Durant, some football players, even host broadcasters like Doris Burke, tennis players, si Djokovic. Lahat po sila, there's one thing in common with them, they were all affected with the virus. And lahat po sila actually were brave enough then to disclose that they do have the virus and are recovering, or they are getting past it, or they have gone past it. So this is what I call the COVID Wall of Fame. If you look at it from a sporting context, lahat po ng mga sports ay pinag-aaralan din ng COVID. Kasi when it comes to their own respective leagues, they would want to make sure that they maintain good studies para ipagpatuloy po yung liga nila. And what's a good thing to see here is that as these people came out with their information, hindi naman po nagkakalayo sa mga nakikita nilang mga numero when it comes to how COVID is seen in the community. Basically, some good things that people will point out. Bagamat marami nagpa-positive, maybe the statistics that we should also keep in mind then is that maybe close to 9 out of 10 or a little bit more than that are either asymptomatic or gonna be having mild conditions lang po kapag dumaan ng COVID sa kanila. Bihirang-bihira naman din po yung tatamaan talaga ng moderate to severe. That being said, meron din po talagang mga tao na predisposed or tinatamaan din ng COVID in a moderate and severe manner. If you're looking at the NBA, I think they're the ones that had a big, expensive bubble. They were able to get a positivity rate. Positivity rate po meaning ilan po nagpositibo among those that tinest po nila. And pasok pa rin po yan sa mga general positivity rates na nakikita nga po sa komunidad. For us locally, we keep tabs of statistics with regards to our national athletes and all our sports stakeholders who disclose that information to us. Medyo mababa rin po. But obviously, as we continue to see trends in the community, papansin din namin, medyo sumasabay-sabay din po siya. Kung madami sa komunidad, medyo dumadami rin po yung mga atletang nagkakaroon ng positive wherever they are located in their home communities, or whether they are serving as frontliners in the military or doing their roles in society then besides being an athlete. Ang importante na gusto ko rin i-highlight, whether abroad or here, wala pa po kayo siguro nababasang sikat or prominente or talagang may pangalan na atleta na nagkaroon ng tinatawag nating catastrophic na COVID or ikinamatay po niya yung kondisyon na yan. That being said, we do respect how it can devastate somebody, but knock on wood, and it's nice to point out pa rin na for the athletic population, para naman pong wala pa po siguro tayong makuhang balita ika nga ng isang tao na tinamaan po ng COVID na siya po ay nag-agaw buhay or nag-pass away. So with that, it's nice to talk about first how it did change our lifestyle in the context of sports. Number one, pansin po ninyo, if you look at your cell phones, marami kayong mga dina-download na tinatawag nating mga city contact tracing apps. Sa panahon po ngayon, hindi kayo makakilos, hindi kayo makapunta kung saan man without making sure that you have your own QR code or you're filling up health declarations forms, etc., etc. No? These things have a purpose. And just to let you know, syempre gusto rin bantayan kung sino talaga yung mga nakakakilos sa kapaligiran ay siguradong walang binibit-bit na kondisyon or hindi sila nagkakaroon ng kapasidad makapanghawa. So that's the importance of this thing called health declaration forms and contact tracing apps. A little bit of comment, the personal note is I hope they do get it to be on one contact tracing app for the whole nation para mas mapadali-dali po yung proseso na yan. Secondly, you do notice that this word started to crop up. It's called personal protective equipment. Pag sinabing personal protection, Pangunahin po dyan syempre yung sa mukha natin. Usually you talk about face mask, face shield, maybe a personal hand sanitizer siguro. Maybe some people would like to wear gloves. Will talk about in detail ng mga mask guidelines later on. No? But just to let you know, lahat po ng yan ay nagiging pangkaraniwan na sa buhay natin ngayon. Next, we learned how to communicate virtually. Again, prior to 2020, we were used to seeing people live, attend meetings in a room, maybe hold lectures and sessions and guided education ng magkaharap po at pinapakita nung nagtuturo kung paano niya ginagawa yon. Then 2020 came, we had to adjust. We had to make sure that we are versed in things like Zoom, virtual consult, maybe Viber calls. All of these things are actually helpful for us kasi ganito rin po natin na monitor yung mga tao natin. So for example, if our athletes need consults, we do something called telemedicine or teleconsult. If they do need or if they have a question for any of our coaches, strength and conditioning, they can consult them and get appointments to their telecoaching program na platform. So this is one good way for you to actually adjust into that lifestyle and make sure that you have ready capabilities for that. Next thing we notice is that actually games are now organized differently. I'll tell you more later on how I was able to be a medical officer in an actual international tournament. And from that experience alone, masasabi ko po na binago talaga ng COVID kung paano tayo magpa-conduct ng laro or magpa-conduct ng tournament or magpa-conduct ng actual na paligsahan wherein everybody tends to be confined in one space / a bubble. Napaka-restrictive, medyo nawala ng fun ng konti yung environment or ambience ng mga tournaments at competition. But that's how it is. We will just tell you later on more about how these things went about. There were a lot of rule changes. So for example, even yung pagkain ng atleta afterwards, nakabox na sila, hindi na sila kumakain ng tabi-tabi like in a buffet line. Individual na po yung pagkain nila. Even yung pag-shower pagkatapos po ng laro, may konting restriction. No? After nila maglaro, pinauuwi na muna sila at doon sila nag-shower kung saan sila naka-hotel or saan muna sila nakatira. So all of these things are minor things, but they tend to really affect the way that the game is played as a whole. What do we currently know about COVID-19? No? And I use this word novel nga siya, no? Novel coronavirus. It being novel, bago po siya. So if you think about it, something that is new, wala pong eksperto. Wala po talaga makakapagsabi na alam niya ang kasulok-sulukan or kalit-litan na detalye kung paano mag-adjust, paano mag-cope, or paano gumawa ng guidelines when it comes to something that is new. So with that thinking, people will just tend to evolve in line with what they currently know about the virus. Ibig sabihin, as you get more information about it, dyan lumalabas yung mga guidelines that you will be coming up later on as you get more accurate evidence-based information about how the virus behaves. So what's factual about it? Ang maganda ay majority ng mga tinatamaan po nito asymptomatic or mild nga, katulad ng sinabi po natin kanina. No? That being said, ang problema dyan is pag hindi pa tayo nagkakaroon nito, hindi natin alam kung paano ito dadapo sa atin at kung ano epekto nito ang gagawin niya sa individual na tao kapag dumapos sa kanya. And that's maybe the scary or the hard part because we don't know how it can actually afflict us later on. But that being said, if you're going to bank on statistics, maybe 9 out of 10 times, hopefully, sana naman kung ako yung tamaan yan at mabait ng statistika sa akin 9 out of 10 times, I will probably not experience anything drastic or severe about it. Next, unfortunately, compared to the other ones that have afflicted us in the past, chickenpox or measles or whatnot, yun po ay sometimes may lasting immunity. Dito po sa COVID, wala po talagang immunity na masasabi mong panghabang buhay. So unfortunately, that's the situation that we are in right now. It doesn't mean that you've had it, means that you are not gonna be up for a reinfection later on. So pwede pa rin po mangyari yun. Now, this is important and I'd like to highlight this later on. It's called a timeline. No? Ang medyo maganda naman sa information na nakukuha po natin sa coronavirus, medyo may behavior siya na parang masasabi nating sumusunod sa timeline. So that timeline, which I'll elaborate in a while in the next slide, is very important as to how we understand our behavior, attitude, and protocols na gagawin when it comes to how we approach the virus when it is in our community or when it is perceived to be something that we can control if we are planning on hosting certain games or certain practices. Isa pang magandang malaman is that theoretically, ang athletic performance po hindi naman nakikita. Lalo na kung ang isang atleta ay dinapuan ng COVID pero wala man lang siya naramdaman na simptomas when it comes to his breathing or sa puso po niya, chances are he will not experience anything permanent. But obviously, this is still under research, and as we get more information later on, that's what we currently know about it right now. Next is, kung mapapansin po ninyo, sometimes pag may kakilala tayo, no, nag-positive si ganyan, nag-positive si ganito, medyo may panic mode na konti. Sometimes I'd like to point out that, okay, so nag-positive siya. No? Ang tanong is, yan ba'y bago? Yan ba'y luma? Siya ba'y nakapanghawa pa or hindi? So also, you can pause first and think that when somebody approaches you and tells you that si ganyan nag-positive, first thing you ask yourself is, okay, I know that 9 out of 10 times siguro medyo mild, moderate lang siya. Secondly, saan siya nag-positive? Siya ba'y nag-positive na nakakapanghawa pa siya or nag-positive lang siya pero hindi na siya nakakapanghawa at patapos na siya doon ika nga sa timeline ng virus. And that's the important thing concept-wise that we'd like to make people realize. And maybe getting the proper information across is very important. What do we have to find out where you are in the timeline? It's testing. Bukod sa clinical po na nakikita natin kung sila po ay may symptoms or wala, which is very important also. Testing is one way for us to find out if you are positive na infective, nakakahawa, or just negative. Wala po talaga at that current point in time na tinest po kayong nakitang virus sa sistema po ninyo. So the way we do that is something called RT-PCR, and you guys have probably seen how it's done. I probably had more than 30 sticks up my nose. Lampas na po ng 30 pumasok sa ilong ko na stick, and all 30 of them are negative RT-PCR-wise. I can tell you a side story about it. I think I've had it back in January 2020, attending a football tournament in Bangkok, na that was the last known time na naalala kong nagka-high fever ako, ubo, sipon, and then hindi pa uso yung nawawala yung panlasa, nagkaroon po ako noon. Tapos after that, wala na po ako naging sakit until now. Up until now, hindi pa po ako nagkakasakit. So maybe for all I know, I've had it in the past already, but among all of the 30 swabs that I've done, negative po lahat. There's such a thing as a gold standard, and RT-PCR po yun. Nowadays, meron po kayo makikita na maipapabong test. Tawag nila serology or kinukuha ng po ng dugo. Yun yung parang pinapadaan sa isang white na maliit na disc, tapos yung dugo po ninyo magta-turn out ng either positive or result. In the past, they call it the rapid test. No? So may matinatawag na rapid antibody test. Nowadays, ang rapid antigen po, kailangan din po ng swab sa ilong. So that's the one that we have currently right now. No? What do they matter in terms of kung alin po ang importante? Papansin niyo sa mga testing, merong convenient, madaling gawin, mabilis ang resulta, pero may konting issue sa accuracy. Yun po yung mga rapid kind of testing. Still, the gold standard remains that RT-PCR is very important kasi it tends to give you mas accurate and reliable na result. Kasi for example, no, if you're using a rapid antigen test and you get a negative result out of that rapid antigen test, meron pa pong 20% chance na yung negatibo po ay actually positive. So it becomes a false negative po yung rapid antigen. So hindi pa rin po talaga tunay tayong makakasigurado na porket nag-negative po tayo sa rapid antigen, more or less safe na po tayo. But it's a very good screening tool, and even the DOH recommends it for a surveillance and a point of care na testing tool. But it's not supposed to be something that guides you in tinatawag nating decision making ikang. Ito na ang pinaka-importanting slide ko for this lecture, and I'd like to spend a few minutes on this only because if you understand this slide, medyo maintindihan niyo po ninyo yung COVID. I'll start off by saying na unang-una po, ang virus ay timeline. So sumusunod po siya more or less sa isang petsa. At yung petsa na magandang isipin po natin na una ay yung 14 days. That's why people will always tell you na more or less may 2 linggo na pwedeng mag-incubation period ang virus po sa inyo. And can you see my pointer, everybody? Spino, can you see that pointer? Yes.
Yes, sir. Yes, sir.
So this line from here to there is that 2 weeks. It's 2 weeks before even your symptoms come out. So yung 2 linggo po na yon, pwedeng nagtatago yung virus or bit-bit po ninyo. That's why we are also somewhat cautious of people being asymptomatic carriers. Pwedeng tahimik lang sila nagdadala ng COVID po, and yet they are actually potentially makapanghawa. But wait, hindi po necessarily ganon. Yung period po na makakapanghawa, people will tell you, yung talagang pinaka-delikado for somebody na makapanghawa sila is a period of 2 days before the symptoms come out up to 7 days po since lumabas yung symptoms nila. So minsan, isipin po natin na nag-positive ka dito, 2 weeks before, nag-positive ka dito, may konting tsansa pa rin na positibo ka pero hindi ka makapanghawa. As compared to dito ka nag-positive sa area na to, positibo ka na nga pero mataas ang chance mo nakakapanghawa ka pa. And therefore, it's very important to also find out at which point in the timeline yung isang tao para masabi po natin sila po ay nakakapanghawa pa at positibo versus positibo lang po sila pero hindi na masyadong nakakapanghawa. Pero we don't like it to come across as saying na, well, baka naman pala ako hindi nakakapanghawa. No, don't quote us on that. Importante po ay respetuhin po natin that anybody who still tests positive is required that 14 days from the time he tested positive to quarantine. Yun po ang kaukulang rekomendasyon, batas maybe, or guideline recommended by the DOH. That once somebody tests positive, you do have to quarantine yourself. If you are not sick, you do have to isolate yourself if you are sick for the next period of 14 days. So, importante pong isipin yun. Now, what about somebody who tests positive? Take a look at this blue line po. No? Itong blue line. Yan po yung RT-PCR na line. Kung mapapansin po ninyo, yung line na yan, umaabot na hanggang week 6, 6 na linggo. So, theoretically speaking, ang isang tao ay pwedeng nagbibigay pa ng virus, yung mga remnant or natitirang portion ng virus all the way up until 1 month and a half or maybe even more. Sometimes people will tell you it's around 90 days kasi may remnants pa po na virus na nadedetect po sa ilong po nila kapag sinaswab sila. And that's a true situation. Pero you also go back to analyzing all of the information very well and ask, okay, kung lahat ng test ko po ay positive, chances of me being infective at 4 weeks later, baka mababa na rin po. That's why people can be let go of quarantine as early as 14 days after their initial test na nag-positive po sila. Now, what about the antigen and antibody? Okay, ito rin ang implication kasi ng test. No? Take a look at this red line now. Yan. Maliit lang yung antigen. No? Parang 7 days before symptom onset up to plus 7 days after symptom onset. Ang sinasabi naman sa antigen is kapag nakita po na positibo kayo sa antigen, then chances are nakapanghahawa po kayo. At positibo po kayo talaga sa COVID-19. Pero it still will require a confirmatory na RT-PCR test po. And then, pag medyo bumaba na po yung antigen, no, dito na naman sisipa yung antibody natin, yung mga panglaban natin sa COVID-19 na infection po natin. May 2 klase po ng antibody, yung IgG at IgM. Usually, yung pinakamahabang protection po na makukuha natin ay manggagaling sa IgG. Ang problema, base sa mga pag-aaral po ngayon, papansin po natin na siya ay tumataas, tapos bumababa. Hindi katulad ng mga iba nating nakaraang mga infeksyon na kapag nag-antibody po ito, nananatiling mataas po sila, or alam na po natin ang level or numero ng antibody na protective po sa atin. Ang problema po sa COVID, wala pa pong may alam kahit sa parte ng mundo kung aling level ang protective sa atin at naobserban po nila na ang antibody na ito ay bumababa over time. And therefore, pwede pa rin po talaga magka-infection uli ang isang tao na nagkaroon na ng COVID. Pero chances are, hindi po ito mangyayari sa unang mga 2 o 3 buwan ng pagkakuha po niya ng COVID na infection. Alright, so I hope this timeline is very important for you to analyze all of your tests and how you understand COVID and why there are things like 14-day quarantine, etc., etc. Now, if you are symptomatic, meaning dumaan po ang COVID sa inyo at kayo po ay nagka-simptomas, 2 lang po ang direksyon niyan. Either magpatuloy po yan or talagang makakuha ng sapat na proteksyon ang katawan ninyo at mag-produce ng enough na panlaban pa kontra sa COVID and therefore you can expect some kind of remission or improvement after a few weeks. For some of them who don't improve, they attribute it to one thing. Ito yung tinatawag nating marami siguro silang ACE receptors, ACE. Kasi ang ACE receptors po ay makikita natin sa baga, makikita natin sa puso, sa mga blood vessels. At kung ikaw po yung individual na unfortunately maraming ACE receptors sa inyong katawan, baka pag dumaan po ang COVID sa inyo is makakaranas po kayo ng mga moderate to severe na mga simptomas. The difficulty of breathing, yung mga problema sa circulation, etc. or even sa puso. But unfortunately, I don't think anybody can find out who has this as an individual. I'm not quite particularly aware kung if you can even test for the presence of ACE receptors in your body, but if there is, baka hindi pa po yan readily available sa lahat, and therefore you can't really predict kung paano po dadapo ang COVID sa inyo. Okay, that's the serious part of the lecture. The easier part of the lecture is, okay, sige, alam na natin yung lahat about COVID. What happened to us in 2020 or 2021? Fast flashback po, maybe around 2020, no? Maybe we all are aware that the date of infamy ika nga is March 13, 2020. Yun, hindi ko makalimutan, Friday the 13th yun eh. Doon pinato yung tinatawag nating lockdown, all of these restrictions in activity. Doon natin una siguro narinig mga word na ECQ, etc. And talagang ghost town, no? You can't even find a place to eat. So even groceries, wala pa masyadong protocols or mga restaurants, and therefore you were just left to stay at your own house for the next few weeks or few months. Now, maybe around May, medyo nagkaroon na ng liwanag ika nga, no? In the sense that the countries who initially had it, China, Italy, UK, were the ones who were initially hit, at yung dumaan yung wave sa kanila, sila rin more or less yung unang nagkaroon ika nga ng liwanag na lumipas na more or less yung COVID sa kapaligiran nila. And therefore, people start to talk and explore possibilities of returning sports in those particular countries. Even Australia, I think we're doing a good job at containing it. So they were actually one of the first. AIS, or the Australian Institute of Sports, this second one here, was the first to publish that booklet outlining protocols for how to ease back sports in their country. And then sunod-sunod na. Sumunod ang football, sumunod siguro ang basketball, and then all of the other international federations followed suit. Just to give everybody a guidance kung paano ibalik ang sports sa kanila. And that still basically forms the framework or reference tool that we use when we discuss something later on about its local version that we did for easing sports back into our own country. But just to give you an idea on what happened when, right around May, yan, unang liga na bumalik, sikat na sikat, Koreans, yung K-League na tinatawag nila sa football. Even as early as May of 2020, nakapag-host po sila ng liga po nila. Obviously, closed-door environment, walang spectators, may protocols in place, nagsuswab ang mga players, etc., etc. Pero uwian. And then right around June din, yung Germans, Bundesliga, football din po. I keep a close watch on football kasi po, being a doctor for football, and they were also one of the first few peoples to return to sport. UFC, mixed martial arts, tried to return sometime around June. Meron nga silang masinsabi, tinatawag nilang Fight Island, yung naka-isolate sila sa isang island sa Abu Dhabi, etc. Doon lang sila para walang labas-pasok po doon, mas kontrolado nila yung COVID sa kapaligiran. Yung una, medyo may konting disaster, puro mga nagpapositibo yung mapapasok sa island na yon. So nausog po yung mga matches po nila until they were able to eventually pull it off and proceed with their calendar of MMA activities. Right around June, ito yung isa pang medyo negative event din kasi yung mismo organizer, si Novak Djokovic, parang ano po niya to, parang project po niya to, nagpa-host siya ng tennis tournament. Unfortunately, siya at ilang mga tennis player nagpositibo rin. So medyo nakakuha sila ng mga negative backlash in the sense na sinasabing masyadong maaga pa, etc., para ibalik yung sport na yun sa lugar na yun. And then we all know about the NBA story, no? They were the first to maybe coin the word bubble, and it became so marketable as a word that people started to copy that word thinking they're talking about the same thing. But bubbles are entirely different in nature, and we'll talk about that in detail later on. for me, my honest assessment, it seems successful kasi they were able to complete the season all the way up until December. And most of the time, ang success po naman kasi ng pagbalik ng isang sport nakasalalay sa protocol na gumigiya sa inyo. Yan. And so if you have, I think, a 100 or 200-page protocol that's very much meticulous in its detail, that's a good start. And then the NFL or American football actually was able to complete their season to culminating all the way to Super Bowl. What about locally? No? Ito nga yung sinasabi po natin. No? As early as May, our team of doctors actually thought about this, and we were coming off ECQ, I think, or MECQ at that time. And we thought of adapting it for the local environment or the local situation that we are in. And we come up with something called a framework tool for introducing sports in a COVID environment. We coined it Filipino First. Our goal was to keep it simple, no? to provide a framework or a guide for any entity, any stakeholder, anybody who would want to restore sports in a particular environment, obviously following what we currently know in terms of classification, yung mga tinatawag nga na ECQ, MECQ, GCQ, MGCQ, and yung tinatawag na new normal. That was actually our guide in coming up with this particular framework tool. The pinaka content po nito actually is very simple. You still have to follow existing provisions of the Department of Health and IATF. While this is used as a guide, kailangan pa rin pong ipinagpapaalam or ipinapattern yung protocol in line with what you currently know about all of the existing guidelines and provisions for safety brought about to us by the DOH and IATF, only because of one simple thing. We don't want sports to be accused of something or a group na siya pa ang nagpapadrive ng pag-spread ng COVID, or it's something that is also a culprit when it comes to overwhelming the healthcare system. That's why we use all of these guides in order to make sure that people realize that it's not just about restoring sports safely, but it's making sure that we think of the overall community and our nation as well. All right. So dyan, papansinin nyo, mga around May, June, July, I think lumabas ata yung mga sports na pwede na. So, for example, cycling, yeah, jogging, you can safely do that kasi number one, they're outdoors. Number two, there's tend to be solo activities. We got a good laugh when some people commented on social media, ay, equestrian nandun, ay, skateboarding nandun. Sino ba naman ang pwedeng maganyan? Hindi ba naman si skateboard? That being said, we're talking about sports that we deem safe because they were practiced in an outdoor setting more or less, or in a solo or individual environment where there's a little bit of chance of cross-person interaction, ika nga na tinatawag. And obviously, as you progress along in the community quarantine classification, more and more sports can actually be practiced safely, provided that they follow all of these protocols. Now, what about kung hindi ka pa pwede lumabas noon? Kasi again, we were flashing back to around ECQ, MECQ, pa lang, ano? DOH actually, PSC, MSAS actually partnered with DOH. And so we thought about this very well. And ano nga bang gagawin natin? Nasa bahay lang sila. So we partnered with DOH and came up with this program called the WISE program. We got our pool of famous or mga sikat na athlete role models to do things pro bono. So they did it willfully on their own to come up with short spills or talks or demonstrations on how to conduct sports safely at home or do home exercises or what. And we think it was very successful and people appreciated it based on the feedback that we got. Secondly, dito nyo mapapansin na bago rin to, ng COVID, tawag dyan infographic. Dyan lang sumigat ang infographic Kasi ang infographic, napaka-convenient. In one squarish poster, kita mo na lahat ng information na gusto mo. It's very attractive. And partly, we have to thank our PCO Communications Office for this, for coming up with lovely and informative graphics that we find very helpful for driving the message across. So dyan nagsisimula yung information campaign that we did for middle part of 2020, where we were still in the middle of the pandemic. Yan. Hindi lang sports. So we always thought about things that we can help with the community. So even nung di pa lumalabas yung mga infographic about eating in the workplace, paano bumalik sa trabaho, QR codes, health declaration forms, paano sumakay sa public transportation, lahat po nang yan na nailabasan na ng PCO office namin yung mga infographics related for that. So we thank them for their collaboration with that, for that as well. Okay, take a look at this for a few seconds. I think we're coming towards mask use. All right. It's a very nice picture. Cristiano Ronaldo nasita. Sikat as he is, nasita pa rin siya for not wearing the mask when everybody else was wearing the mask. No? Ito mapapansin mo sa COVID, walang sinasantoy ka nga kung sikat ka or hindi, medyo masunurin ka or hindi. It will really enforce a lot of behavioral changes on us, whether we like it or not. Mostly from a moral obligation or a social responsibility standpoint, and besides the public health safety issue, talagang kailangan po natin pag-isipan mabuting sumunod. Kasi at the end of the day, if you do it and everybody else is doing it, it's for everybody's benefit. Diyan pumasok yung advisory and exercising with the mask, which is one of our flashpoints ika nga for last year. No? Syempre, we will hear a lot of comments about this, how to do it better, do it best, ika nga. But at the end of the day, it's very simple. No? Exercising and mask is a mixture of a lot of things. Physical performance, exertion, breathing, accumulation ng carbon dioxide, mas mahirap kang mag-execute ng gagawin mo kasi restricted yung breathing mo. Those are factual. But obviously, with everything that you come up with, you also have to think about existing national guidelines. I think IATF brought about that as an existing national guidelines regarding mask use. May konting mixture ng common sense at may konting mixture ng practicalidad. So all of these things, for a simple use of a mask, we find that we need to educate everybody on how to use a mask effectively and safely in a sporting context without compromising safety and public health. And so that's been out already way back pa in the PSC Facebook page. But in a simple way to put it, really, you just have to think of three things: practicality, maybe common sense, and then later on, the physical and public health safety issues that come along with wearing a mask. So if we're gonna come up with a sample mask protocol, and this is just a sample mask protocol, you can come up with something similar. Obviously, if you know that all of the participants there have a known COVID status, ika nga, na test sila, alam nyo na negative sila, and they're gonna be practicing, and they're allowed to practice, you can do away with the mask. Kasi you basically know that everybody's COVID status is negative, ika nga. But when you tend to interact with people of unknown COVID status, / hindi pa sila na-test or / hindi mo pa alam kung saan sila nanggagaling, it might be risky to just say, take off your mask and interact with one another. So basically, ganun po yung mga konsepto when it comes to deciding who is safe to wear a mask, who is exempted from wearing a mask in a sporting / training kind of environment. And this is where you will really have to present your protocols and guidelines, maybe have it approved by somebody who knows the principles, and afterwards, it's smooth sailing already. Yan na, bad ng mga June, July na tayo, no? I think medyo pabinbin tayo, pabalik-balik, ECQ, GCQ, GCQ, ECQ. So more or less, we sort of got lost as to how to proceed when it comes to resuming sports. Right around this time, I'd like to also inform you that there's this thing called the JAO. It's a Joint Administrative Order Group. These are government bodies. It's composed of the PSC, Games and Amusement Board, and Department of Health. Basically, this triumvirate, yung tatlong grupo, are the ones responsible for ensuring and enforcing and being accountable for all of the sports stakeholders, depending on where they fit in among these three sporting bodies. Sorry, the sporting bodies and government bodies. So basically, if you're in professional sports, you're more or less answerable to GAB. If you're an amateur, non-professional sports, you're answerable to PSC. At the end of the day, these three meet and they present all of their decisions and suggestions to the Department of Health, who will have more or less the final say on what is safe to proceed on when it comes to resuming sports safely. So one of the things that they actually decided on was obviously PBA, and basically the PBA was able to conduct a sporting bubble after getting the nod or approval of the JAO and the IATF. Now, what about local protocols for sports resumption? Mapapansin po natin, may kanya-kanya tayong opinion, may kanya-kanya tayong protocol. And therefore, it doesn't mean that it's acceptable, doesn't mean it's allowable, pwede na. Maganda rin po sana talagang sinasangguni sa health professional at siniguradong yung prinsipyo na kinopya or linif ay tugma at sang-ayon sa mga prinsipyong medical to prevent any kind of spread of COVID. Yun lang po. But everybody is enjoined or encouraged to do a protocol on what they think is going to be safe when it comes to resuming sports or training in their particular local, particular communities or schools later on if it's allowed. Okay, ito, madalas natin marinig, no? Bubble at circuit. The JAC actually came up with a supplemental guideline on this, on bubbles and circuits. Ito po yung tinatawag nating training environment. Training pa lang po, no? Kasi bihira pa po aprobahan yung actual na competition. But when you want to conduct a competition, syempre, sisimulan nyo muna sa training. And when it comes to training, may tatlong environment po ang pinaka-summary niyan. Pag sinabing open environment, uwi ang player, may kanya-kanyang bahay siguro, may kanya-kanyang pupuntahan na training field or training pitch, and then they can go anywhere, nag-grocery, namamalengke, etc., magsisimba, pupunta sa opisina. That's an open environment. Basically, they're allowed to roam around wherever they would want to go. Pag sinabing closed circuit, simple lang po yan. They go from 2 locations lang and nowhere else. It's a very rigid and strict, if followed, na guideline na bahay ka lang, training area, uwi ka na sa bahay mo. Bahay ka lang, training area, uwi ka na sa bahay mo. Closed circuit po yan. Wala kang dapat ginagawang ibang side trip. Wala kang dapat ibang ginagawang kung ano-ano mang mga unauthorized movement outside of those 2 locations. Kaya nga po siya closed circuit. Obviously, with these kinds of training environment, may kanya-kanyang risk, may kanya-kanyang mas mahigpit na chance magkaroon at may kanya-kanyang mas malaking chance magkaroon ng COVID. Pinaka-rigid yung tinatawag na bubble. Kasi pag sinabing bubble, people also have to understand that may tinatawag na parang semi-bubble or full bubble. No? Pag sinabing full bubble, una, lahat po ng mga occupants ng bubble na yun, ika nga, ay walang uwian. Una, mula player, coaches, media, organizers, even medical people, ambulance, etc., housekeepers, security, driver ng vehicle, ay nasa loob ng bubble. At lahat po yun ay na-test. It tends to be very costly, I must admit, no? But basically, it offers the highest level of protection in terms of contracting or getting COVID. So we also understand na hindi yun ang pinaka-perfect na modelo because of the logistical and costs involved. And so sometimes people will always tend to modify a full bubble concept and work their way from that to come up with what's acceptable for their particular kind of league. And that's okay, as long as you can get it approved by the relevant people who make sure that the risks are kept to a minimum. So yan yung tinatawag na open environment, closed circuit, tsaka bubble. Now, let's take a look at actually what happened to us locally nung last year, no? Right around May, it was the first time we started to have results come in kasi doon naman din medyo nagsimula pa yung testing, no? We had 7 athletes test positive. Nagsimula po sa ganon. To our count, in a year's time from May 2020 up until March, just last week, we had a total of 21. No? So in a year's time, we had 21 athletes from all disciplines, from all locations around the country disclosed to us that they've had a positive. Fortunately, 100% of them never required hospitalization or whatnot. On a sad note, on what is maybe just the known COVID-related condition affecting an athlete locally, we had one young footballer die. She's a female collegiate high school footballer who had a pre-existing na condition po na congenital, and then unfortunately she got afflicted with COVID po and passed away then. No? That's the only one, no, na maisip po natin na nagkaroon. But we can't really say na it's gonna be the norm for everybody who gets COVID kasi among those who we've seen so far, maybe that's the only exception that we can cite so far in over a year's time. Nobody else had a similar story. One of our RP athletes from Sambo, I think it's Mark Striegel, fought in the UFC. He tested positive for it. I think he was cleared to play or to fight later on. Unfortunately, he lost by knockout, but essentially he was not hospitalized as well, and he actually recovered enough in time to fight for his match. PBA, we know, took place. 3-on-3 chooks to go took place. Philippine Football League took place, and all of these 3 leagues actually proceeded and finished their seasons more or less uneventfully naman po. Now, where are we now? December. So December, medyo wala po masyadong liga noon. January, the thing that opened up our year was when our Olympians got the approval to return to training because of the upcoming Olympics in July. So when they got approval for that, it was going to be in a bubble concept, and they're currently training right now in Inspire Calamba, Laguna. Some of them actually have left for their own respective Olympic qualifiers. But more or less, we can say that the concept and the preparations made were safe in the sense that they were able to currently leave for their trainings elsewhere or the Olympic qualifiers in other nations then in preparation for the Olympics. We had one hosting that was actually postponed in February. It was for FIBA basketball, but I think it's still on the pipeline to be returned here, and we are still bidding to become the host for it sometime in June. Obviously, we're waiting on how things will play out. But so far, those are the only ones that we know of that have officially applied for approval for resuming their respective sporting leagues. There are a handful of others. You could probably read about them who have applied for resumption of their own leagues, and they have actually taken place or what. But these are the ones that we can cite so far. What about school-based sports? Ayan na, maraming mga school-based attendees tayo today, no? As far as we know, they've already charted or drafted their protocols, obviously still waiting approval. I think it's the face-to-face thing classes that are still being prioritized first before you can actually resume training. But protocols are in place. Relevant stakeholders have talked about how to safely resume sports in the collegiate, high school level. So we're just waiting on actual approvals for this before we can see them actually go to a particular practice training venue and do their thing. Okay, talking about the COVID and the athlete, I'm sure you guys will encounter athletes na you will see. Ano po ba kailangan nating bantayan sa mga yon? Una-una natin isipin, pag tinamaan pong atleta with whatever that they have in terms of their fitness capabilities, they're on the good side, ika nga, na chances are they don't seem to be affected as much as compared to the general population. That's a good thing to think about. Secondly, hindi po masyado silang tinatamaan ng moderate to severe death. And that's also a second good thing to think about. But obviously, they can still be carriers, they can still be infected, they can still be subject to the same things that you see in somebody in the community. Na madali lang din sila makakuha ng COVID kung hindi sila nag-iingat at nagpa-practice ng mga measures. Local data, as I said, 21 so far by our count. 80% asymptomatic, all recovered, nobody got hospitalized among our count. You have to understand that these are the ones that just disclosed to us. Ang isang medyo unique sa Pinas or to our countrymen, mahiyain eh. So medyo ayaw pa po nila sabihin na nagko-COVID sila for some reason. And we respect that. So we only will tally or take note of the ones that actually disclose to us. No? Similarly, yung COVID Wall of Fame natin kanina, wala pong COVID Wall of Fame na local version. Wala nagsasabi kung sino pwedeng ilagay yung picture nila na nag-positive sila for obvious reasons. So, it's a Filipino thing na they want privacy siguro, but that's fine. And we will never force them into disclosing their positive results. So what would you do if your athlete, you see an athlete who's recovered from COVID-19 and seeks your help to resume training? How would you want to approach them? Keep it simple, no? Number one, syempre, obviously, if you're non-medical, you can ask for some kind of help from a medical person. But these are the things to think about. Una-una yung tatanungin is kung dinapuan ba siya ng COVID na nagkasimptoma siya or hindi. Kasi kung di naman siya nagkasimptomas, that makes your job a little bit easier. And then you can basically start doing simple things to see where they are at in terms of their level of physical fitness. If una nilang sabihin is nung dinapuan sila ng COVID, nagka-symptom sila, ubol, sipon, lagnat, then maybe start to consider getting a medical clearance. So their lung function, their heart function, and all of their other functions are evaluated. Now, what other things do you want to consider for them? remember, meron ng stigma ng konti yung pagka-positive, ano? So obviously mental health or mental issues are important for them. So kung gusto niyo ipa-consider ang ipakausap sila, okay din po yung ganun. Pero minsan meron silang mga issues sa sirkulasyon, may issue sila sa presyon or blood pressure nila, may issue sila sa performance nila. At kung may mapansin kayong slightest na pagbabago doon, ipa-consulta nyo na po just to make sure that proper tests are done for them to go back to sports safely. How many days do we need from somebody who tests positive before they can be eventually allowed to return to sport? We talk about a graduated plan. Ang graduated plan po, progresibo. Hindi yung tipong, tapos ka na ng 14 days mo, okay, laro ka na. No, hindi po parang ganun yan. We want to make sure that we continuously observe them for up until 2 to 3 weeks to see if any symptoms will crop up or lalabas kapag sila po yung nanggaling sa COVID. But basically, you need at least more or less sweet spot around 10 to 17 days bago po nyo sila safely pabalik sa sport and with the adequate medical clearances. Sa panahon ngayon, madali na lang. If you go to Shopee, Lazada, or sometimes your watches even have this, may tinatawag na pulse oximeter o yung nagme-measure ng blood oxygen levels natin. So yung fingertip oximeter, dinidikit lang po dyan, siguro mga 300 pesos yun. If you find it useful for you, go ahead and get one. It tells you how much your pulse rate is going on at that particular point in time, pati yung oxygen levels po ninyo. Again, basically, it's all about staging yung progression po ng pagbabalik sa sport. Yung gradual, incremental pag-improve po nila, minomonitor, binabantayan every step of the way kung nagbabago po yung paghinga or yung presyon or kung yung oxygen level nila, yung heart rate nila. You can do the simple measurements. Always check for two things, yung paghinga po, tsaka yung puso. Yun lang po gusto nating emphasize dito for returning somebody to sport. And before everything, you want to make sure na monitor po sila at may tinatawag na pre-competition or pre-exposure, pre-exercise medical assessment. So if you know of these forms at ginagawa po niya yun routinely for your school, gawin nyo na rin po sa kanila if they're coming off a COVID-19 infection history. Now, I got to talk about all of these things we mentioned a while back in a unique experience that I was in last year. I was able to be a chief medical officer for a centralized football tournament. Na yung masasabi natin bubble talaga. It was held in Doha, Qatar. Isang buwan po kami nandun. There were 16 teams, 480 players. So parang isipin po natin parang mini World Cup kasi sa World Cup may mga 32 teams, no? So sa kanila 16 teams po ang nagpunta. So ang dami pong tao, ang daming test na ginawa. Tulad sinabi ko, nagbago talaga ang pag-organisa ng sport. Maraming bawal, maraming bagong behavior na kailangan gawin. Hindi automatic na yung ginagawa natin po dati ay pwede na rin gawin ngayon, no? So nakaka-shock sa akin bigla coming off from what I know as to how far I covered sports before the pandemic. So one of the things I actually noticed was that maraming swab. So ang swab rate po nila doon every 6 days. So walang nakakaalpas para ma-reset po yung bubble. May tinatawag na mandatory interval swab at para masiguradong walang outbreak na makakalusot. Lahat po sinaswab, even yung yung hotel staff, yung drivers, lahat po yan nakapila, nakikipag-swab po para masiguradong wala po sa kanilang may COVID. Second is temperature checks. Katulad naman nakikita nyo ngayon, automatic pa rin po na kung sino mang may simptomas, sino may lagnat, hindi po pinapaalis ng hotel room, hindi pinapaglakbay, talagang dapat just stay in your place and call somebody that you have symptoms and don't report in for that day. And that's a very important thing also to keep in mind, lalo na ngayon na kung wala kayong kapasidad magpa-test, just make sure that if you're symptomatic, stay at home. Statistics-wise, maganda yung resulta. 56 lang out of 8,563 swabs. Napakababa po. I think it was like, if I'm not mistaken, 0.6% positivity rate. And that's much, much lower than what you see in the community. Ngayon po, ang Pilipinas ata, nasa, last I check, 10 to 11% positivity rate. Kumbaga sa 100 testing po nyo ng swab, 10 po doon ang magpo-positibo. As compared to before March, siguro mababa tayo. I think na nasa 5 or 6% lang or 5 out of 100 lang ang nagpa-positive sa sinaswab. Ngayon, medyo mataas po talaga. No? That being said, a bubble environment, kung napapansin po ninyo, hindi po rin zero. So meron din pong mga nakakalusot for whatever cause, whatever reason there is, na hindi rin totally 0% ang makukuha ninyong nagpa-positive inside the bubble. Yeah. What's the importance of that? Ito, pumapalo yung protocols and guidelines. Kasi kung merong guidelines na matino yung liga, merong guidelines na matino yung team, hindi mo napapalago yung numero ng mga nagpo-positibo within your team or within your tournament. And that's why you're gonna be referring back to your Bible, which is your guideline protocol. And if you do have a good guideline or protocol in place, therefore you can prevent your leagues from getting shut down, and you can allow it to proceed safely with all of those decision points in place na hindi ka malulusutan ng, paano kung ganito, paano kung ganyan, what happens with like this, kung may 5 ganyan, ilang nag-positive. So just make sure you have all of these guidelines and protocols in place. Make it scenario specific na imagine mo na lahat ng posibleng mangyari ay napaghandaan mo, and therefore you can proceed safely with your league. Okay, almost done. Just the final segment of my lecture. Let's talk vaccines now. Medyo, as I said a while ago, napaka-trending po ng bakuna. Only because wala na tayong pinag-uusapan masyadong COVID, no? Bakuna na mode na yung general na nakikita natin sa mga balita until March came along na tumaas uli yung mga numbers natin sa kapaligiran, no? So what are the various vaccination talking points? Number 1, you hear this word, roll out prioritization. We'll tell you more about that. Number 2, choices. Number 3, ito ba'y okay, hindi ba to okay? So performance-related questions when it comes to the vaccine. First things first, roll out. Ano ba yung roll out? Ang bansa natin ay bumibili at nakikipagsangguni sa ibang bansa kasi di man tayo producer ng vaccine. So kailangan tayo makihanap katulad ng mga iba't pang bansa sa buong mundo kung saan po kukunin yung pinoproduce na vaccine na syempre pinag-aagawan din ng buong mundo. Yan po yung tinatawag na roll out. So I'm sure we're getting it in the news that so and so amount will arrive, 400,000, 1 million by this date, etc., etc. And that's how much you expect the vaccine to arrive in our country also. We're beyond this, but we're just giving this information for you as to how to follow the news. Ika nga kung nasaan na tayo sa dami na dumadating na bakuna sa bansa natin. Now, when it comes to prioritization naman, ito medyo nagsisimula na. Nakakabasa kayo ng mga balita na, ba't si ganyan nauna, ba't si ganito nauna. Yan yung tinatawag na prioritization. Kasi sa prioritization, mayroong A, B, and C. Pinakapangunahin po ay A, eligible. Ang A, unang A bago B eh. Hindi mo nauna ang B kay A eh. So dapat si A muna. Pag sinabing A, A1, healthcare workers. So una po mapapansin niyo na mga nasa Facebook ninyo na unang natuturukan, mga doktor, nurse, medtech, mga nursing aid, kasi sila po talaga yung nasa prioritization list ng bansa. At any nation will follow that prioritization list din po. And then you talk about senior citizens. And then you talk about those with comorbidities or illnesses. Putting it into context, if you're an athlete or a sports stakeholder at healthcare worker ka, makakuha ka kagad ng bakuna. If you're a regular athlete, healthy, otherwise no problem, baka wala ka sa unang prioritization list. Although I've heard of some House members putting up a proposal for some of our Olympians and some of our SEA Games athletes to be put in that prioritization list again. But we'll keep an eye out on that. No? But that being said, siguro kung atleta ka, maybe a field spada athlete, mas mauuna pa po kaysa sa mga non-field spada athlete. Kasi sila po pwede pumasok sa A3 sa mga people with comorbidities. No? So they can legitimately get in the vaccine line and get vaccinated right away as people are following the rollout of the prioritization plan. And then susunod na dyan yung mga B, yung mga nagtatrabaho, yung mga etc. So but that's what you call the prioritization plan. And it's gonna be chaos later on kapag sinabing ako na muna, ikaw na muna, ba't si ganon, si ganyan. But if you just want to follow the news, yan po yung tinatawag na prioritization ng pag-roll out ng bakuna. Who has gotten it? I will tell you that wala po kayo makikita masyadong sikat na atleta pa sa buong mundo na nakapagbakuna na. Because other nations nga naman ay sumusubaybay or sumusunod sa prioritization. So unless nga yung atleta na yon ay healthcare worker, malamang di pa po siya na bakunaan. So what you have right here in front of you are 3 people. Kahit nakamask sila, kilala yung si Jabbar, si coach ng San Antonio Spurs, Greg Popovich. Sabihin nyo, hindi mo sila atleta nasa sports sila Well, they're senior citizens. So kaya po siguro sila nabakunaan kasi nasa nasa next level po sila ng prioritization after the healthcare workers. The one on the extreme left is a football player in Qatar, formerly of Barcelona, si Xavi. So sa Qatar, halos lahat sila nabakunaan na. No? So maybe his prioritization actually reached him already. But ganun po ang expectation. No? Hindi nyo po makikita si LeBron James, yung picture na nabakunaan siya. Hindi nyo makikita yung isang atleta na si ganyan ay may bakuna. Medyo malayo-layo pa po ang atleta sa prioritization plan rollout ng vaccination. Ito na ang tricky part. No? How do vaccines work? Kasi marami rin kayong mababasa kung ano. No? So you have to really be very careful, very picky, and very selective with the information that you read. Kasi meron tayong fear, pero pag yung binasa natin ay yung nagko-confirm ng fear natin, di parang yun na yung truth. So hindi dapat ganoon. Dapat yung fear niyo hanapan niyo rin ng both good points and to support it, or something that contradicts that fear also to make sure that you get the information and come up with a reasonable choice kung ano po yung gagawin po ninyo. But basically, there are 4 kinds of virus. I would like to use the word na high-tech sila. High-tech sila kasi unang-una ginagawa sila sa laboratorio. Hindi po yan naturally occurring na mga bakuna. Merong a lot of science and a lot of technology is involved in creating a vaccine. Pag sinabing viral vector, meron silang sinasakyan na dating virus na pwedeng silang magdadala po sa sistema po ninyo para matrigger po yung tinatawag nating immune system na mag-produce ng panlaban or pangontra doon sa COVID-19. Meron din pong ibang bakuna na ang ginagamit nila ay components ng bakuna ng COVID-19, yung tinatawag na RNA or yung protein nito, na kapag na-recognize po yan or nakilala ng isang taong na-injectan ng bakuna na gano'n ng prinsipyo, matitrigger po na mag-produce ng mga panlaban, yung tinatawag nating T-cells or B-cells na sila pong pupuksa doon sa COVID-19 kung napuan po kayo nito. That's what they do. Basically, kapag ang bakuna po ay nasa sistema po sa inyo, nagtitrigger po siya ng pag-responde sa katawan ninyo na magpo-produce ng mga sundalong lalaban should COVID-19 infect your system. And that's how simply they work. What about actual things that we have in the world right now? There's a handful of names that you will see, but some of them are actually not here yet. What we do have right now in our country are the following. We've seen Sinovac arrive. We've seen AstraZeneca arrive. We've heard of Gamaleya being third to arrive. And Pfizer, as far as I know, Moderna, Novavax, Johnson & Johnson are not physically available yet for everybody to be rolled out, na nasa rollout prioritization na mabigyan. But so far, those 2, Sinovac and AstraZeneca, has been well documented naman po na naibigay na sa marami mga Filipinos, specifically healthcare workers who are first in the prioritization list. Ito po ang estado nila kung nasaan na po sila sa pag-roll out sa bansa natin. If you see that list, there's this thing called emergency use utilization approval, sabihin EUA. Dapat payagan po muna silang gamitin for our countrymen sa bansa bago sila maibigay actually sa taong i-injectan nito. And so far we have 4 approved na may EUA na po sa bansa. Among the 4, Pfizer has still not arrived in our country yet. As I said, AstraZeneca and Sinovac have arrived in our country. I was just scanning the news. Gamaleya has arrived ata rin or in the process of being prepared for rollout na rin for being given to our countrymen as well. And then there are others coming from Bharat Biotech, Moderna, Novavax, and Janssen. When it comes to vaccines and vaccine choices, napakasimple lang po. 2 lang po ang choice. What's available and kung ano po ang, actually isa lang ang choice. What's available and what's actually inside your arm. Yun lang po ang pinaka-choice na mabibigay sa inyo sa bakuna. Parang tipong pipila ka kasi tapos pag tinanong mo, ano po bang meron kayo ngayon dyan? Meron po ba kayong ganito, ganyan, ganon, ganyan? Hindi ganun po ang vaccine rollout line. Kung saan ka maupo, saan ka maupo na pila, doon yun lang po ang choice nyo na makukuha for that day. Kasi when the full list of vaccines arrive in the country, it's not like a store that you will just get to pick which ones you like and comfortable with. That being said, the choice is still up to you to decide which is the one that you feel comfortable getting for your own body. But obviously, parang ako rin pag sinasabi ko sa kamag-anak ko kung bakit ako nagpabakuna, simple lang po ang sagot ko. One day na nagpabakuna ako is one day earlier na hindi ako na-expose sa COVID na potentially ika-delikado ko. Meaning the earlier I get it, no matter what form, what brand, or whatever it is one day that I might have saved myself from any and future harm. So that's how I think. Vaccination FAQs and myths surrounding sports. Ang medyo maganda sa atleta or may athletic background, it seems that anybody na may ganung background kapag binigyan nyo ng bakuna, mas napopotentiate o mas tumataas pa po ang responde ng katawan nila sa pag-produce ng mga T-cells na siyang lalaban at silang pupuksa sa tinatawag natin na COVID-19. As compared to maybe somebody who's sedentary, walang ginagawa, walang sporting background, ang isang tao po na medyo may athletic background, maganda po ang chances niya mag-produce ng enough na panlaban sa COVID-19. One thing you also note is that timing is very important. Kumbaga magpapabakuna ka, tapos for example lang, meron kang malaking meet competition na lalabanan, maybe give yourself 1 month. Maximum na siguro yung 2 weeks before you get that injection. Kasi you would want to monitor yourself for any kind of side effect as well if you do have any. And in most cases, wala naman po masyadong side effect except for some injection area related issues na makikita po ninyo. In fact, for most athletes, when they get vaccinated, ang mga nararamdaman lang po nila yung parang soreness dun sa braso nila kung saan sila pinag-injectionan and a little bit of something called myalgia and nothing else. What about post-vaccination guidelines? Ito, aminado tayo, nag-evolve pa lang. Hindi porkit nabakunaan na po tayo ay parang protected din tayo na pwede tayong bumalik sa walang mask, etc. or walang protection. No. As the nation continues to be vaccinated, we still follow the same things because we don't know yet a few things about certain vaccination behavior. No? We don't know how long it can give us immunity. We don't know how it will behave to certain kinds of variants. But all of these things are still continually and dynamically being processed information-wise by the relevant scientists. At kapag nakuha natin yung sapat na informasyon, then we can safely disseminate it to every one of you. I personally have had my shot of Sinovac. I'll get my second one on April 6th. I think Dr. Espino had Sinovac as well, or maybe AstraZeneca. Those are the 2 choices that we got. But this slide basically shows that even as far as the Olympics is concerned, hindi mandatory ang bakuna para mag-participate sa Olympics because they do know that they don't want athletes jumping the line and getting ahead of other people who might need the vaccine more. But they do encourage, if you're in the proper prioritization, to get vaccinated then. But it's not going to be something that you will require of somebody when it comes to sports participation as of this time. So basically, just my last slide, in summary, talagang with COVID, marami pa po tayong natututunan. Di po natin pwede sabihin, alam na natin lahat. And with whatever currently that we know, ina-apply po natin yan whenever we start to behave and think rationally and objectively when it comes to forming our own protocols, guidelines on how to proceed safely as we navigate through this pandemic. Basically, marami po tayong adjustments na gagawin, and that's one of the things you'll get to realize as your sport starts to get approval to be resumed, at least for practice and eventual competitions. So I do hope that whatever I shared today can be of help to you. Maybe as you start to think and talk amongst yourselves kung paano po i-resume safely ang sport sa inyo, makakatulong po itong lecture na ito. This is what I'm looking at for 2021 and beyond. In the last 2 bullet points sa baba, I do hope at some point it can be safe to resume community recreational sports and collegiate sports. I don't know exactly when and how this is going to happen, but those are the 2 ones that we are waiting on from the relevant people, decision makers, ika nga, to make sure that these things can proceed safely. Thank you. I hope I didn't take too much of your time. Matagal pala, no? Thank you.
Thank you very much, Dr. Molo, for that very informative lecture. I'm tasked to give a synthesis of your lecture. However, my synthesis is actually like, I think, 4 pages. So I'm just going to emphasize some of the things that Dr. Molo has said. No, so obviously, COVID has changed sports all over the world, and there is what we call the COVID Wall of Fame, kung saan yung sikat na mga artista, mga atleta rather, and sportscasters were afflicted and have been recovered. Now, as we all know, there is about close to 9 of 10 athletes who are afflicted are asymptomatic or have mild symptoms. Now, locally, we also have our own athletic community, and about 21 have been infected, but 80% of them are also asymptomatic or mildly symptomatic. And we also have a low positivity rate, which is the same as the community. So we're very lucky because wala tayong sikat na atleta na nagkaroon ng catastrophic event because of the COVID. Now, how did it change our lifestyle in the context of sports and just plainly our lifestyles? Nandiyan na yung mga bagong cellphone apps, mga virtual workouts, nauso yung mga bubbles, the games are now being organized differently. Narinig na natin yung mga bawal mag-shower sa mga games. As I mentioned, the bubbles nandiyan, you cannot eat in front of each other or sama-sama or dining in groups are now not recommended anymore. Now, what do we currently know about COVID-19 is there's still no one who's an expert because it is relatively new. And guidelines evolve as we go along. And then as Dr. Molo has been mentioning, majority of the people who are infected have mild or no symptoms, and we are not yet sure of how long the immunity will last. However, what's important would be the 10 to 14 days or the test-based recovery definition of COVID-19. So he also mentioned that your RT-PCR is still the gold standard of diagnosing COVID-19. So remember, those antigen swabs are not really the gold standard. So you want to confirm, you do an RT-PCR test. Your antigen swabs rather are not 100% accurate, but maybe a good screening tool. However, it's only for surveillance and not for decision making. Now, for the viral timeline, it's important to note that the incubation period of the virus may be as long as 14 days. So when are you more infective? You're more infective or most infective 2 days before the symptoms come out until about 7 days after the symptoms. But anybody who has tested positive is still required to do quarantine for 14 days. Now, it has been studied that some of the people are still positive even until 90 days after the infection, but the chances of being infective after 2 weeks from symptoms are very low. Now, he has mentioned about the ease of the returning to sports. He gave us a timeline, started May 2020 with football, UFC, and then June, tennis came about, the NBA started the bubble, and then we had a long talk about exercising with and without masks. However, it's very important that everybody needs to be educated on the proper use of masks without compromising health and safety. And just note that when you tend to interact with people with unknown COVID status, meaning hindi mo alam kung siya ay meron or siya ay positive or hindi, it is not safe to remove your mask in front of that person. And Dr. Molo went on to discuss about the bubbles in the circuit. So you have the open circuits, the closed circuits, and the bubble, which is the most rigid among all the three kinds of, I would say, sporting communities for now. And he has also mentioned that school-based sports are still awaiting approval. Protocols are in place, but we're still waiting for the final approval for that. And lastly, we talk about the COVID and the athletes. So athletes don't seem to be as affected adversely as compared to the general population. Again, mostly are asymptomatic or mild. And how do you approach your athletes who have had COVID? Have them seen by a doctor if they have symptoms for medical clearance. So they have to have their heart and their lungs checked and evaluated. You may also refer them to psych for evaluation. And you have to make them return to sport with a graduated return to sport plan. It's important for you to observe for 2 to 3 weeks after infection to see if there are any symptoms that are still going to come out after 2 to 3 weeks. The golden period would be 10 to 17 days before they can return and at least 7 days symptom free. So remember the activity progression, and do take note, there's what we call the pre-competition or pre-exercise medical assessment, which is very important for these athletes. And finally, he has discussed about the vaccines rather, so rollout prioritization and how the different vaccines work. And he has actually mentioned that it is very important for us to be vaccinated with whatever is present. Kasi dalawa pa lang ang nandito. And yes, I have had my Sinovac vaccine injected also, and I'm still gonna have my second one on the 5th. And I do agree, I've been with him in the bubble, and I've had about a third of the number of swabs he has had about on his nose. And it's not fun, but it's what we do, what we can do to make a sporting community and make the sport, I would say, safe for now. And with that, I would like to open the floor for some questions. I already have one question, actually, Dr. Molo. So the question is, this is from Davao. I'm not sure if it's a rugby player or a coach from Hilton Soberano. Just to clarify, you mentioned that there is no lasting immunity. Does that mean vaccines are temporary solutions only?
Thank you for your question, sir. Remember, when you get vaccinated, no, it's a way for you to actually get a protection from what the vaccine is known to combat. Usually, it's COVID-19. Now, what it does is actually it triggers a response sa katawan, panlaban sa kung ano meron ka, and most importantly, it prevents you from getting severe manifestations kapag dumapo sa inyo ang coronavirus. So, kasi may lumalaban sa katawan mo, no? That being said, yung pag-aaral po sa bakuna ngayon, ang masasabi lang po nila is effective po siya sa kung anumang variant dinevelop po yung bakuna na yon. And maybe for future variants din. Pero nobody can really say that with the finality yet according to the CDC. That's why they still would want to recommend that you practice all of the safety measures. One of the things that we will know with this virus is that nakaka-frustrate. Wala bang pwedeng ibigay na lang na masasabi mong permanente na, panghabang buhay, pangmahabaan? Nobody can say that yet. But between not getting anything and getting something, ipupusta ko yung sa getting something. Dahil pag wala akong kinuha, dahil i-argue ko na hindi naman siya panghabang buhay, then I put myself at risk. But when I get something, for all I know, whatever I get right now can prevent that disastrous thing from affecting my health. And therefore, I'll take my chance on that. That's why sometimes you get things like booster shots. So minsan may mga booster shots sa ganyan. Or minsan, if you've had experience with flu vaccines, tatanungin kayo ng doktor mo, saan po ang punta nyo? Sa Northern Hemisphere, sa Southern Hemisphere ng mundo? Kasi meron din pong bakuna na pang flu, na pang doon sa lugar na yon. May bakuna rin po na pang flu na pang lugar dito. So we do know that viruses mutate, they behave, matatalino rin sila, they will change their configuration or form, and therefore vaccines are just a race to make sure that we are protected as what the virus is trying to do to try to get ahead of us then.
Thank you very much for that very good explanation, Dr. Mola. I have another question from NLEX, Kennedy Leander. I'm sorry if I didn't read your name right, but the question is, there's such a thing as false positive result? Negative antigen test, but positive RT-PCR and vice versa.
Okay, talking about the antigen test first, no. Let's say you take a negative, you take an antigen test and you test negative for it. As I said a while ago, there's still a 20% chance na positive yung antigen test mo na naging negative initially. So it becomes a false negative. So what do? You take an RT-PCR. When you take the RT-PCR, nag-positive ka sa RT-PCR. And therefore, you're a true positive na meron ka. Naging false negative yung antigen mo. Automatically, kapag nag-positive ka na sa antigen, most likely, or I think 95% of the time, positive din yung RT-PCR mo. So, kino-confirmatory test pa rin ng RT-PCR yung positive na antigen test mo. Now, when it comes to a false positive na RT-PCR, yes, I have to agree there are things that can happen that are like that. So, all of your tests, RT-PCR, ginawa, and suddenly, on subsequent test, biglang nag-negative siya. People can consider a few things. Baka nag-false positive ka sa RT-PCR for reasons of cross-contamination, laboratory handling, etc., etc. But again, dito rin papasok yung clinical na pagdesisyon. kung paano gagawin yung test, paano ita-time yung test, at anong klaseng test ang gagawin para confirmahin sila or hindi. But there's possibilities of true positives, false negatives, and if I'm gonna give a tip, don't presume it's a false result. Una. Presume it's a true result before you conclude otherwise.
Correct. Okay, I have another question. I have a raised hand here. Mr. Ismael Genovea Jr. from TCU. Can you please turn on your camera and unmute yourself so you can ask Dr. Mola the question? Thank you. Host, can we unmute Mr. Hold on.
Ay, good afternoon,
Yun,
Doc.
there. Thank you.
Doc, ano ba tama? Kasi nagbabike din tayo, no? Dapat ba talagang naka-face mask tsaka face shield o pwedeng tanggalin ang face mask tsaka face shield? Tapos pag may tao na lang, parang gagawin ba natin na aware tayo pag nakita nating meron tayong nakakasabay na dumidikit sa atin, hihinto tayo tapos ikakabit natin yung uli yung face mask natin?
Remember I was talking a while ago, no? Minsan, when people think of a provision, a guideline, face mask, face shield, you have to balance three things. Common sense, existing public health provisions, ika nga kung ano yung binibigay niyan, tsaka yung science, ika nga. So yung pag-aaral tungkol dyan. Now, obviously, depends on the context of the situation. But as far as I know, na-repeal natin yung face shield sa mga siklista, no? Importante yung mask. So let's say ako, avid biker din ako, no? Nagbibisikleta rin ako. And I want to go outdoors and bike. If I'm gonna bike sa isang hindi mataong lugar, I can cheat a little bit. Don't quote me on this. But when I say cheat, I can lower it gently with nobody around me. And therefore, I spare anybody na sa tinatawag nating breath cloud ko dahil wala naman tao doon. Ika nga. Secondly, I can be creative in what I use for my personal protection whenever I go out and exercise. To be honest, I have a mask. I have, ano ba tawag doon, yung face covering. Yung parang tela lang na ginagano, binababa mong ganyan. And you can mix and match depending on the current situation that you're in. Obviously, in a mataong lugar, in a lugar na nagko-cross sila sa path mo kasi stoplight, etc., etc., depends on who's interpreting the situation. You can be accosted for not using this, not using that. Ika nga. So again, contextual ng paggamit ng ito. So balansyado po dapat yung common sense, yung existing public health provision, yung performance benefits or issues that you can get out of it. So yeah.
Thank you po, Doc. Thank you.
Thank you. Okay, I have another question from DepEd, Mr. Steven Enchong. Sir, na-discover na po ba kung saan po talaga nakuha yung COVID virus? Thanks po.
Nope, no updates on that. I think parang ganito yan. No? If you're people are still exploring. Just to let you know, we keep a tab or a close watch on this then. But knowing where it originated from and how lethal, how fast, how to contain it also is the implication of that. No? So people are still exploring that. But minsan, it's not the place that's important. It's how they behave, how they mutate, how they can become so lethal, how they can become containable rather than the place where they came from.
Another question from IKBF rather, or FKBI. Mr. Ray Del Prado is asking, do you see sports at schools changing because of the epidemic? If so, how?
Yes, again, obviously, we know sporting calendars for schools have been on hold for the longest time. And I've heard a lot of stories. Obviously, some of my student athletes that I take care of, losing scholarships, losing opportunities. It's very hard to recruit. Go to provinces to see how they play when there's no play going on. So bagong-bago talaga yung sporting landscape as far as how people used to do things. And if for a calendar year, for example, gusto mo may palarong pambansa, national games, etc., and that's where you see people excel and recruit some of them even. Where's your opportunity to do that now? I mean, virtual, pwede siguro, but ganun siya binago, no? And until we really get to see a clearer picture as to how certain things are gonna be done, which is obviously taking a back seat to a public health issue. We just have to be patient. Yun lang po talaga.
All right, I have a couple of questions. Oh, I have a raised hand. Sige, let's talk. Mr. Hinove, you have another question? Do you have a follow-up?
Ay, Doc, tawag dito, ito bang virus na to, gaano siya kakaiba dun sa nakalipas na, iba yung parang every 100
SARS.
years? O,
Ay, no. I mean,
gaano siya katindi yung pagkakaiba niya doon sa ibang virus na nauna na sa ibang panahon?
oh, I think the last pinakasikat one na buhay tayo lahat siguro noong 2003, 2001. If you've heard of SARS, I think SARS-CoV-1 is the name, but SARS
Yeah.
afflicted Hong Kong more than us. What's different? Yung SARS parang medyo kusang nawala, tumahimik, nag-fizzle out, nawala. When SARS was doing its job na kumalat, mabilis din siya. At parang ganitong COVID-19. Ang difference, most of the ones who carried it were symptomatic, may symptoms. So madaling na-contain siguro nung mga public health people yung SARS. As compared to this one, talagang kakaiba siya. Kasi we hardly saw something that you carry asymptomatically at mabilis ka makapanghawa. And therefore, the measures to try to contain something like that na invisible, quote-unquote, napakahirap. No? So, maybe it's something that's not basically goes on a cycle of every 100 years. It's basically how viruses have become smart then as to how they do their thing. Dati, kaya mong i-contain sila sa ganitong paraan. Ngayon, syempre, naghanap sila ng equally magandang diskarte para makaiwas sa tao. And therefore, it's very hard to catch them. That's what makes this one so difficult.
Thank you po, Doc.
All right, so Mr. David Alino from Bohol Province is asking, may I ask, would you recommend antigen tests of the two athletes before a boxing match?
No. Usually po parang ganito. No? Balikan natin uli yung timeline. Maganda isipin yung timeline. No? So let's say may boxing match ako sa April 1. Ang una kong iisipin ay yung 14 na araw bago mag-April 1. Kasi alam po natin na 14 days po yung incubation period more or less ng virus. So parang una kong sasabihin, kung may boxing match ka na April 1, mga right around April 16, magsimula na kayong maglimitan ng movement mo, galaw mo, kilos mo, huwag na kayo masyado makipaghalubilo sa mga mataong lugar, etc. etc. Then maybe around 7 days before that, April 23, you get a swab test. Just to be sure na in that 6 days na may chance kang nag-grocery, nagpalengke, wala kang nakita. So that's around April 23. Maybe right around April 30, you can take another RT-PCR test. And that's more or less a safe way to assume that you got yourself covered in terms of being an asymptomatic carrier. Pero hindi pa rin foolproof yun. Kasi whatever you're doing, kung nasan ka man, hindi ka nakakulob or nakakulong, still puts you at risk for being exposed to carrying the virus. But as close as possible to the event itself, you just want to contain things and make sure that malilimitan mo yung chance ang magpositibo sila. Antigen, if you're looking at the timeline po na pinresinta ko kanina, has a very narrow period lang from minus 4 days up to plus 4 days na magpositibo sila. So technically speaking, pwede ka ring carrier ng or infected ng COVID pero negatibo ka sa antigen. So kaya po natin di sila masyado talagang hina-highlight. Though we know that we can still use them for what we call point of care ease of results testing. Mabilis kasi, daling lumabas no? Less than a couple of hours, may resulta ka na. That being said, we don't like to use it for decision making. Sabihin, hindi siya yung dapat pang decision mo. Pwede siyang pang surveillance, pang screen, pang ganyan. Yeah.
Okay, I have a question from Jacqueline Mendoza of AFP. Does wearing mask affect your performance when you're doing physical activity like running and jogging?
Yes, 100% yes. Any kind of restriction to your breathing will affect your performance. You yourself can notice this easily. No? Escalator, hagdan, lakad ka, mag-mall. Mahirap ata, parang hahapo ako. You can consider yourself fit. Only because of the air exchange, oxygen, carbon dioxide accumulation, things like that. Now, dito papasok yung mga material as to what you kind of use for your mask. You can use a breathable material or you can use a restrictive material like a surgical mask N95. Both have their own advantages and disadvantages. Mas mahirap huminga, mas protektado ka sa virus at mas protektado sila sa'yo. Mas madaling huminga, may chansang nagdi-dispel ka ng virus at may chansang may nasasagap ka rin ng virus. But obviously, we just want to make sure to put the message across that any kind of protection that maximizes your potential for getting a virus is the one that you should use. And kahit ako, I have different kinds of masks depending on what I need to do. If I want to do surgery, if I want to go to the clinic, if I want to exercise, I tend to bring with me different kinds of materials for my personal protection.
All right, another question. We are down to our last two questions from Raymond Lyon of UCCCSC. Good day, doctor. Is there any necessary specific lab tests for your athlete in the medical clearance? For example, X-ray and ECG or CPET for reference and all for heart and lungs?
Yeah. Sa mga pagbabasa po natin, no, wala pang strict guideline na must do diagnostic test po. In fact, working with certain athletes that who've had positive and we need clearances for them, when we refer them to specialists, usually cardiologists, pulmonologists, they may or may not get diagnostic test po depending on the screening test or the questions that they ask the athlete. So ganun po ang prinsipyo din sa ngayon. No? While it is nice to get a test, kung sabi nila kasi, no, kung wala ka naman baseline nun before, how would you know what changed? No? That being said, kung magpakuha ka ng test, then that's all there is to it. Gagawin mo siyang parang baseline for future tests to find out if COVID really did affect them or not. Again, if resources are there, minimum ECG siguro, chest X-ray, 2D echo. But obviously, if you have more than enough resources, you can do CPET, stress test, or whatever if you want. Basically, it's nice to put these numbers and results into a context na nakumpara mo sila in the past before they had COVID. Otherwise, that's all there is. No? Whatever the percent with right now may be beginning pa lang ng deterioration or baka yun na yun or wala naman deterioration. So you will not know until you get subsequent tests after that.
For the final question, I'm going to combine two questions because they're related. The first one is from Ray Christian Rigoroso. Sir, may pag-asa ba na magkaroon ng province or municipal bubble sa sports? And the other one is Homer Tacubanza, who said, is it possible for a bubble format for college sports event like SCUAA?
All right. So when it comes to yung chances, una pong babalikan yung komunidad. Unang tatanungin kasi, asa na yung komunidad nyo? Kayo ba yung nasa GCQ na? Nasa ECQ pa ba? Kung meron mang ganun, nasa MGCQ na. And then, that's the start. Kasi depending on the community classification po ng lugar na hostan gaganapan na sports ninyo, mag-iiba-iba syempre po yung kung gaano kalinya at gaano kahigpit yung mga protocols na gagawin. But the protocols remain the same with the intention of making sure that everybody is protected. So, ang pinaka pwedeng gawin sa ganyan, obviously while there are national bodies, the JAO that oversee everything on a national level, sometimes you get to see certain things decided at the LGU level. So, at the municipal LGU level. Kung isipin lang po natin na as long as alam po nila yung prinsipyo and they are reflective of the healthcare capacity ng lugar na gaganapan yan at medyo more or less mababa ang numero sa lugar na yan, I'm sure mas may chance pong matuloy yun as approved by the LGU. What's the second question? Sorry po. School-based.
SCUAA.
Again, we're talking about a school. Usually, it's nice to ask: are they located in one district, in one location, or is there travel involved? Is there gonna be places that they will be going to? Kasi, for example, even a simple island like Negros, for example, you have so many towns. Pwedeng sa town na to mababa ang COVID. Pwedeng sa town na to mataas ang COVID. So when people are planning for sporting events, they should take into consideration kung anong pinaka-format po ang pinaka-workable. Kasi when you put people in a bubble, anong ibig sabihin nun? Unang-una may cost. Pangalawa, nakabinbin sila doon ng pagkatagal-tagal. No? So everything can be planned. Ika nga. But if the plan is good, rational, sound, then it can be successful.
Thank you very much, Dr. Molo, and thank you everyone for the participation in this afternoon's National Sports Summit. Back to you, Joash.
Thank you very much po, Dr. Randy Mola and our
Thank you.
moderator, Doc Janice, for the very cohesive open forum and synthesis. We are bound by time restrictions. Marami po kayong tanong about this topic and we are very glad that you are really participating. But marami pa rin po kayong questions yet to be answered too. Kaya po we encourage every one of our participants to please chat in ang inyo pong mga tanong that will be included po on our data processing. Wala pong data will be wasted on every session of the National Sports Summit. That being said, we will now take this time to honor and award the Certificate of Appreciation to our speaker for the sports conversations. To award the certificate to Dr. Randy Molo, we may now call our Sir Mark Edward Velasco. Sir?
Yes, thank you, Joas. No, I'd like to personally thank Dr. Randy Molo. For those who don't know, Dr. Randy Molo is also our chief medical for the Olympic team. So actually, since last year up to now, Dr. Molo and including Dr. Janis have been very busy po. Very, very busy. Not only that, they're also frontliners din po. So they have their regular work as frontliners and as doctors po natin sa community. So in behalf of the Philippine Sports Commission, we present the Certificate of Appreciation to Dr. Randolph M. Molo for his invaluable contribution as a resource speaker for the sports and COVID-19 topic session of the Sports Conversations, the first phase of the National Sports Summit 2021, dated March 25, 2021 via Zoom, signed William I. Ramirez. Maraming salamat, Dr. Randy Molo.
Thank you.
Thank you, Sir Mark. Back to Dr. Randy. Can we take